Hi guys, welcome back to the channel. I'm back again today to do some more roasting of my subscribers. So thank you so much to all of you who have taken the time to send your pictures through and be so generous with your images as well. I have had so many, I'm struggling to get through them all. So I'm sorry again if your picture isn't in this video. I will do it in the next one, but I will do it. It will be done, I promise. So without further ado, let's go over to our first patient, who is a bit reminiscent of Nicole Kidman. Or is that just my imagination? Let's check out these horizontal lines around the neck first, otherwise known as the necklace lines. And also check out the length of her neck. Isn't that gorgeous? Look at mine. Mine's like this stubby little, I don't know, Lego man affair, but you, madam, have got a fantastic neck. Juvederm Volite, Profilo, TSR Density 1, Regenial, Bioexpander, all those things would be fantastic for the neck. You may have seen people using PDO threads, the monofilament threads in the neck. I think it's okay. Personally, I don't think that the potential downtime and risk of using PDO for a case like this is worth it. I would much rather go with the hyaluronic acid. When I say risk and downtime, there's a lot of bruising and there is a risk of infection with the PDO threads. Plus as well, you can have a bit of the thread coming out through the skin, which, although harmless, can be a little bit distressing for the patient if they're, you know, feeling their neck and then they feel this thing like a bloody great big hair and they pull it out and it's like yay long. Has happened. Is that melasma I see? Can't really see very well on this picture, but it looks like there's a bit of melasma on the forehead. Tricky to treat, really need to be treated with topicals. You can add in a bit of laser if you wish. You can add in maybe doing a peel or two if you wish, but mainstay should really be topicals. When you've done the Botox, you'll see that the corner of this eyebrow will go up slightly. Can't really see the temples, but hell, you know, I feel them on most people, so let's just say that we would do the temple. We do have a few fine lines around the eye. Now, I suspect that these will be above the limit of the orbital bone right here, so maybe better treated using PRP, because you can go super close to the eye. You can also go super close to the eye using something like TSR Density 1 as well. Moving down, we do have a bit of asymmetry, so more fullness on this cheek than this side. You can correct that using a filler. I mean, you're gonna go and fill the cheekbone area anyway, because let's face it guys, we always start by doing that on the vast majority of people. So you would probably just add a bit more over on this side. These nose to mouth lines, you see there's some asymmetry there. So I don't know if you can see this, but can you see right here the way that there's a bit of a pull there? It's a muscle pull, and it's much worse on that side than on the other side. So when doing the nose to mouth line with a filler, which, as you know, I don't actually do it that often, I prefer to treat everything else first and then treat this. You may be able to free up the muscle by using a cannula and kind of breaking the connection between the muscle and the skin with the cannula. It doesn't always work, but it's definitely worth giving it a go, and you might be able to decrease that muscle pull by, you know, 30% or something. We do have some little concertina lines just coming here. That's a skin quality issue. You know, when patients come in and they've got these concertina lines here, not a good idea to just fill them directly, because it can make you look heavier. Think about it. If your lines are here, and you're putting filler here, what do you think is going to happen? This, everything just goes down, and then you look more heavy and more sad. Come on, you have to replace the volume up here, and then you can do something about this. Even so, I wouldn't suggest that you fill it directly. What you may want to do is using a cannula, you go in about there and then you kind of spread it out under the surface of the skin like so, just giving some skin improvement. It's like if you're trying to fold a piece of paper and it folds really easily, but if you have a whole stack of paper and then you try and fold it, it doesn't fold because it's thicker. Same principle occurs in the skin. So make it a bit thicker, it's all good. Lovely lips though, fantastic pair of lips, tiny bit of asymmetry, so you can see that this side is a bit more full than the other side is. You can correct that using a bit of filler. She does also have these vertical lip lines coming, and I would probably use something like Juvederm Volbella for her. You may have to do it a couple of times because it will pretty much keep the shape and maybe just increase the volume very slightly, but it will make the lips look super hydrated. I feel like the width of the chin is a bit too wide. Might be because of the angle, I'm not sure. But remember guys, it's much nicer if on a female the width of the chin is the same as the distance in between the eyes. So a way of tricking the eye into believing that that's true is you put a bit of filler right here and it will make the chin appear shorter. So when you're doing chin filler, you can either make the chin appear shorter or longer depending on where exactly you place the filler. Pretty clever, no? Okay, next patient. Pretty short upper face, don't you think? I feel like we could do with a bit more forehead show. Almost coming around here. Did you notice when Kim Kardashian did that, she got rid of all the little hair on her forehead to expose more? It's kind of like, when did they used to do that? Was it medieval times when they thought having a really high forehead was attractive? I'm sure it was back then. But anyway, in terms of facial thirds, for her it would be a good idea because the mid face, so the middle third of the face is actually quite long and the chin's quite short. So if you make the chin longer and the forehead longer, it will look more attractive. So I would put some Botox in because it might help to lift up the outer third of her eyebrow slightly, and you know, it always looks nice. She has lost some volume in the middle part of the forehead here, so I would probably fill that as well. Of course the major thing is going to be in the mid face. So you see where these two fat compartments are starting to separate here and here. That's not an anatomically correct illustration, but you get the point. And this no man's land is becoming deeper and deeper. So what we do is we fill back here, then we fill right here. And in doing so, you'll see an improvement underneath the eye. Look at that scleral show right there. That's the white bit underneath her eye. That will become improved because you'll get some upwards pressure if you put filler there. By improve, what I mean is it looks more youthful if you can't see the white bit underneath the coloured bit of the eye. Bit of darkness around the eyes. What would we do about that? Well, you can use PRP there. Can work quite well. You can use TSL Redensity 1 there. I quite like that as well, although you do tend to get a bit of puffiness with that one. Carboxytherapy could also be a thing, so that's where you use carbon dioxide gas to inflate the area with the gas, and it tricks your body into thinking that you don't have enough oxygen there, so it increases the blood flow. It can work really, really well to remove, it can work really, really well to decrease any darkness around the eye, but you do have to do quite a few sessions. I'm talking like 10 sessions plus within a short space of time. So if you can do like 3 sessions a week, 4 sessions a week, then it seems to work much better. It is quite unpredictable though. I feel like we're also a bit flat here. I suspect if we saw this patient from the side, she'd be quite flat in the mid face, which is this area here. So I'd want to give her quite a lot of support next to the nose and underneath the eye. So So that's right here and right here. I could also do some tiny little injections all the way in front of her ear, which also will help to give her more vectoring. That's upward swoosh to you and I. Upward swoosh. Chin slightly tilted. You see it's almost going off to one side here. I would line that up with the middle of the nose like so, and extend it slightly because it will give a much more feminine shape to the face. By the time that you've done all that, her lip will probably then look weirdly small because you've replaced all the rest of the volume. So I probably would suggest that she also do some lip augmentation, but not until the end of the treatment, because there's no point. All you're trying to do by doing the lip augmentation is restore any volume that she will have had when she was younger. If you wanted to try and do a bit of facial slimming, because there is a bit of asymmetry here, I'd want to know, what is this? Is this fat? Is this muscle? Is it salivary gland? What is it? If it's fat, then I would do a fat dissolving injection. If it's muscle or gland, then I would put some Botox in there. On to the next. Or what colour? No, we haven't had yellow. Let's do yellow. Okay. Image is a bit tilted, so I don't really know, but I'm just going from what I can see here, which is we've got a lot of volume loss here, here, and here. Also, it looks to me like the chin is starting to curl upwards like this. So I would very strongly suggest that you put some Botox here, 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 and here, and then you put some filler here, 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 and here, and that will make a nice big difference. Don't really know about the rest because I can't really see very much. Eyes, lines, PRP, maybe TSR density 1. Looks like there's makeup, so again it's kind of difficult for me to see. I think there might be some hyperpigmentation as well, so I'd suggest sorting that out too. I bet there's volume loss in the temple just from the shape of the eyebrow, and you know, it can't hurt to have some cheek filler now, can it? Yeah. Anyway, that would be my suggestion. Next. Let's pick a new colour for you, sir. Orange. But not any orange. Oh no, yes, that orange. Kind of hard to see because it's quite close up and there's a tilt, but I would suggest, let's just measure in between your eyes. Oh no, that colour sucks. Should we do yellow again? At least that one was clear. Make it a bit thicker. Distance in between the eyes. There's a tilt in the chin here. You want to make the chin a bit wider as well. Remember, it needs to be the phi of the distance in between the eyes. So we really need to widen that chin. I think once you've done that, there's going to be a bit of a divot here on each side. You're going to have to do the whole jawline. So we make the chin wider here, and then we put filler all the way along here to make it nice and straight. I don't have a side view. Very long upper lip. Now, I can get a bit of an improvement if I put some filler in the upper lip, I can probably get like maybe 2 or 3 millimeters worth of curl up, which will take it about here, but the upper lip is still going to be really long. I would very seriously consider doing a lip lift procedure. You have to be very careful about who you go to for those, because I've seen countless people who have had a lip lift and you can see the scar and it is not nice. It's very visible. Also, people who've had an open rhinoplasty and they have a big scar across the nose. It's awful. If you go to a good surgeon and his soft tissue control is very good and the way that he stitched it up is very, very good and your healing is good, then it's undetectable. But there are so many variables. You really have to make sure you know who you're going to for a procedure like that. But I think it would be nice. If you were going to fill, on a man I like using a cannula. It's just my preference, and I probably use something like Juvederm Volbella or Vollift. I think there's quite a lot of fullness around the upper part of the face anyway. I definitely focus more on the jawline. There's also what appears to be some hollowness in the central forehead. I would fill that. It looks more masculine if from the side your forehead is flat. There's a bit of downward tilt of the eye. I don't know what, if anything has been done in this region before or not. If no, then you may be able to use a bit of filler kind of here to lift up the outer edge of the eye. I don't know. I'd really need to see in person, but that would be my suggestion for now anyway. Okay guys, so that's it for this week. I hope you enjoyed the video. If you feel like being on the channel and you'd like to send me some images through, please feel free. I can do it a lot better if you get somebody else to take the picture for you and you do it on a high quality camera. That does mean that you probably need to email the images through rather than sending them on Instagram, but just send them to the clinic website. And clinic website, what year is this? Like, you know what I mean. Send them to the clinic email and I will see them, and you can always just DM me to just say that you've done it, so that I know that I should pick one up from there. But it's so much easier if it's a good quality image, and if you can get one from the side as well, that is super helpful. So please do. I would try not to wear any makeup when you're doing it, because it's, again, really helpful if I can have a look at your skin as well. I mean, hell, if you want to like send a picture wearing makeup and, you know, from a funny angle, please be my guest, but I will be rating your camera skills then and your makeup skills, not your face. So depends what you want from the exchange, really. Anyway, that's it for this week. Please subscribe to the channel if you haven't done so already, because I'm having like a personal, not bet, but I just want to be like, if I could be at 3,500 subscribers by Christmas when I go to Vegas. That's right guys, going to Vegas at Christmas time. I will be very happy. Doesn't mean anything. We've all got to set ourselves these goals, don't we? Yeah. Tell me your goals. What do you want out of life? What are you doing? Let me know in the comment section below. Let's get personal. I'm going to Vegas for a conference, so closer to the time, if you are not following me on Instagram, then please do, because I will probably be Instagramming like the whole sordid affair while I'm over there. Anyway, enough of my rambling. I look very much forward to seeing you all next week. See you then.